17.2 Mechanism of breathing. Breathing involves two stages: inspiration, during which atmospheric air is drawn in, and expiration, by which the alveolar air is released out. The movement of air into and out of the lungs is carried out by creating a pressure gradient between the lungs and the atmosphere. Inspiration can occur if the pressure within the lungs intrapulmonary pressure is less than the atmospheric pressure. That is, there is a negative pressure in the lungs with respect to atmospheric pressure. Similarly, expiration takes place when the intrapulmonary pressure is higher than the atmospheric pressure. The diaphragm and a specialized set of muscles, external and internal intercostals between the ribs, help in generation of such gradient. Inspiration is initiated by the contraction of diaphragm, which increase the volume of thoracic chamber in the anteroposterior axis. The contraction of external intercostal muscles lifts up the ribs and the sternum, causing an increase in the volume of the thoracic chamber in the dorsoventral axis. The overall increase in the thoracic volume causes a similar increase in pulmonary volume. An increase in pulmonary volume decreases the intrapulmonary pressure to less than the atmospheric pressure, which forces the air from outside to move into the lungs, that is inspiration. Figure 17.2a. Relaxation of the diaphragm and the intercostal muscles return to diaphragm and sternum to their normal position and reduce the thoracic volume and thereby the pulmonary volume. This leads to an increase in intrapulmonary pressures to slightly above the atmospheric pressure, causing the expulsion of air from the lungs, that is expiration. Figure 17.2b. We have the ability to increase the strength of inspiration and expiration with the help of additional muscles in the abdomen. On an average, a healthy human breathes 12 to 16 times per minute. The volume of air involved in breathing movement can be estimated by using a spirometer, which helps in clinical assessment of pulmonary function.